Hello, 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 Facebook. I am Dr. Myla Bennett of Adara Plastic Surgery and Medical Spa in Johns Creek, Georgia. I am a board-certified plastic surgeon practicing primarily cosmetic plastic surgery. Thank you for those of you who have jumped on with me. I know it's late. You know, I have small children, so I have to get my house in order before I do this. Otherwise, I get terrorized during the video by my kids. So, for those of you who are on, if you could share the video and let people know that I'm on. I'm gonna go ahead and share this to my other pages. All right. Hello, hello. Hi, Erica. Hi, Mia. Hi, Ashley. Hi, Tanisha. Hi, Vernell. Hi, Katrinka. Hi, Angel. Frida. Good evening, good evening. So, thank you. I'm tired that, but, I got to comb my hair and put on lip gloss to do these videos. Hi, Shara. Hi, Arlene. So share the video. Tommy, you made it on. I haven't seen you in so long. Share the video. Let people know that I'm on. And I just got mine in October through 25-minute memory gel. You keep getting younger and younger. I mean, Tommy, I age backwards. That's Pretty RX. That's Adara Services. Hi, Janae. Thank you, Vernell. So tonight's topic is an important topic. I hadn't said anything about it, even though a few people asked me to comment on it. And it was kind of like at first when people started, when I first started doing these videos and ladies started asking me to talk about plastic surgery tourism, and I didn't really want to talk about it. And this particular topic, I mean, like, the jury is kind of still out on it, but it's getting so much, there's more and more people reporting that they have issues with their implants and stuff. And so I thought the responsible thing for me to do, since I do aim to serve the people who watch my videos and shed as much light and give my educated, some of it is opinion with this, and the facts we're trying to flesh out as plastic surgeons. So I just wanted to shine some light on kind of like my thought process and the thought process of a lot of plastic surgeons in general about the topic. So I titled the video is breast implant illness real? And I don't like to say something's not real if a person's feeling something, okay? So, but what I can say is, we're trying to figure out the science behind it and figure out correlations that can help us maybe prevent it in people, prevent the symptoms that people are feeling if possible. And at the very least, if we can diagnose it and remove the implants for a person who is having issues, then we can alleviate the problems for people. Now, one thing I do want to preface this whole thing with is that the women who report some of these symptoms from their breast implants, that they believe is from their breast implants, in comparison to the amount of people who have breast implants, the incidence is really low. It's very rare. But if it's you, even if it's 1 in a million, if you're the one, then that's you. That's not rare to you because you have it. So I don't like to dismiss what people are feeling. And so for a lot of women who are feeling some of these symptoms like fatigue or pain or depression or like hair loss, like it's a lot of really non-specific symptoms that different women will report. And they will they feel like it's from their implants. And then, I'm trying to be careful how I say things, but the word out there amongst a lot of the women who are like in groups, support groups for other women who have implants, who feel like they're having these symptoms from their implants, is, remove the implant and take out the entire capsule. So whenever a foreign body is put in your body, for those of you who don't know what a capsule is, whenever something foreign is put into your body is going to kind of like wall it off. And so what is formed around breast implant and any other implant in your body, a knee, a joint, like anything, your body forms a capsule around it. And so the suggestion amongst the ladies who have breast implant and who feel they have breast implant illness is that the implant needs to be removed with the capsule in total. And so, they will call and reach out to different plastic surgeons or plastic surgeons who say they specialize in removing these implants and say they want an en-bloc resection of their capsule with the implant. And depending on what type of implant you have, that may or may not be a reasonable request. So if an implant is excessively scarred or excessively damaged from capsular contracture or whatever, then it might be a nice thick capsule that can easily be taken out. And if the woman has, a fair amount of breast tissue overlying it and the tissues aren't overly thinned out, a capsule can safely be removed in total. But then there's women who are very thin, who have really no breast tissue. The tissue that's left behind is thinned out. Maybe they had a saline implant, and saline implants make much thinner capsules. They're like really thin and kind of wispy. They're adherent to your ribs. And sometimes it's not safe to try to remove the whole capsule in total, especially if it's a thin, healthy looking capsule. And so there have been women who have gotten, who have had complications like pneumothorax, which means the lung is collapsed from trying to remove every single piece of the capsule. So, some women, they feel very strongly like the whole capsule has to come out. And if the capsule is thin and healthy looking, trying to peel it off your ribs may be more dangerous than leaving that behind. Now, if a piece of the capsule is there and it can be seen and it doesn't seem like a safe idea to remove it, that capsule can be burned with the bovie. And so, the times that I've done a capsulectomy and I didn't feel like it was safe for me to try to peel that thing off the ribs, in fear of causing a pneumothorax, I just burn it, because burnt stuff is dead. So, that's one thing. Now, the capsule that remains, that we're able to get out, if a person feels like they have, symptoms as a result of their implants, then what we do is we can send it off. We can send it off for cultures and see if there's like bacteria or some sort of microbe that is growing, like living kind of on the implant, that could be causing the inflammatory reaction that is causing the person to have all these symptoms. So for some of the women who have these symptoms, once the implants are removed, they feel better. So in my eyes, if the implants come out and you feel better, you legit had something wrong. Sometimes that was caused by the implants. Sometimes people get the surgery and they still feel sick. They still feel those symptoms. And what that can be an indicator of is that perhaps there's something else going on in that person's body that's causing them to have those symptoms. So it's not a cut and dry thing right now still, but research is being done in order to try to elucidate the details and figure out, like not necessarily things we could, well, yeah, things we could do to prevent. Because from what I've seen, the women who have been relieved by the removal of the implant, there is definitely a percentage of those women that when the stuff is sent off for culture, things do grow. So when I do breast augmentation, and overall, like, I think that, and the FDA thinks this as well, that breast implants are relatively safe. Nothing is without, there's nothing in this world that's perfect. And the incidence of some of these conditions that people are attempting to link to breast implants is insanely rare. The important thing is to understand the symptoms, and if you have them, be checked out and evaluated by a plastic surgeon and remove them. I personally plan to get some breast implants when I lose weight, so I'm not like and if I start feeling sick, I'll get them out. You know, I've implanted hundreds of women, and I haven't had anybody that I'm aware of that has actually come back to me like, I think these implants are making me sick. I haven't had any of my patients come back to me and say that. Now, they may have went somewhere else and said it. I don't know. But I'm not aware of any of my own at this current juncture. And if one of my patients showed up and felt like the implants were making them sick, you know, we take them out. That's it. That's the end of that, you know. But I do try to educate my patients and make sure that they understand the risks that go along with this particular operation. And that way they can keep an eye out. And if it's anything that's questionable, then, you know, I see them, I examine them, I evaluate them, and do whatever I think is a safe thing for them moving forward. Someone just said, so is fat to the breast safer than implants? So I personally won't do fat transfer to the breast. That's a wonderful question. Breast implants are relatively safe. They're pretty safe. These things that I'm talking about right now are so rare. Complications from breast implants is very low when done by an experienced plastic surgeon who specializes in cosmetic plastic surgery. Fat transfer to the breast, which is popular now, the only time that I would transfer fat to the breast area is in reconstruction, when a mastectomy has been done and there's no breast tissue that remains. So the woman is not getting mammograms anymore. Now, the reason why that is when you transfer fat anywhere in your body, all of it doesn't live. So the fat that doesn't survive is, it calcifies in the area that it's transferred to. So in the case of the breast, when you go in for a mammogram, the radiologist is looking for microcalcifications as an indicator that there may be a breast cancer brewing. If your breast is full of calcifications from fat transfer, guess what? That makes everything confusing. So I personally won't transfer fat to the breast. There's some surgeons who won't transfer fat to the breast, and then there's some surgeons who do it all the time. I don't think it's worth it to have a breast full of calcifications to confuse everybody when it's time to try to diagnose cancer. So I've had a few people who came into me who had gotten fat transfer to the breast. I've had this happen multiple times. Women who had fat transfer to the breast by someone else. And what happens a lot of times, because all the fat doesn't live, is a lot of the fat dies. And they're like, it looked good at first, but then it just went away, and I want an implant now. And so they're required to get a mammogram before surgery after they hit a certain age. And now if somebody tells me they have fat transfer to the breast, I don't care if they're 25, I'm going to have them get one so we can have a baseline study. And the mammograms come back every time, cannot rule out malignancy. And then now they're getting biopsies, they're freaking out. You know, everything's all confusing, and now they have to go through this every year. So I think I personally think that's not a reasonable complication, risk, whatever you want to call those calcifications that develop. I don't think that's reasonable. If it's going to make it hard and confusing to diagnose breast cancer, then I don't think it's a good idea, so I won't do it. So to me, the answer to your question is no, it's not safer. Yeah, I'm personally against fat transfer to the breast. It's just not a good idea to me. I wouldn't put it in mine, and I wouldn't let my mama get it in hers or my sister get it in hers, so then I'm not putting it in you. That's how I see that. I don't think we should be making it hard to diagnose things that can kill us. It should be easy. So, now one cancer that is associated with implants and is associated with textured implants is called breast implant associated anaplastic. It's a lymphoma that develops from textured breast implants, and recently it was linked to one particular implant company. That is super duper rare. And if it does happen, what the women will usually experience is a sudden swelling in the breast that was totally fine. And they have what's called late onset seroma, meaning long after they got the implants, all of a sudden they'll develop this fluid pocket like around the capsule. And once evaluated, if it turns out that you have that, the treatment for that is to remove the implant in the capsule. It's very, very rare, but I make sure my patients know about it beforehand, but I don't use textured implants. So I used to use them only when I would put the implant on top of the muscle. Once there was a connection where it was like it only happens with textured implants, then I stopped using textured implants. So I don't even use those anymore. So that's another thing, but it's extremely rare. So just putting things into perspective, these conditions that the breast implant associated ALCL is definitely linked to implants that are textured. The breast implant illness, we're still trying to sort that thing out. But if you are feeling symptoms and you're feeling sick and you think it's related to your implants, then you should meet with your plastic surgeon or meet with a plastic surgeon to discuss your options. Because at the end of the day, we do these things. Cosmetic plastic surgery is not something that we need. It's just something that we might want, and it's okay as long as we're feeling good and we're healthy. And if you feel like the implants or whatever is making you feel unhealthy, then that's not the goal, and so we need to deal with that. Is saline better than silicone? No, not in my opinion. And also, even saline implants, they have a silicone shell. So if you have a breast implant in your body, you have silicone in your body. And silicone is in like everything. Like it's in deodorant, it's in hair care products, it's in some skincare products, it's in scar creams. Silicone appropriately used is safe. Where you get in trouble with silicone is when people are putting industrial grade silicone directly into their bodies, or like injecting it into places. Like it shouldn't be used as an injection. It should be a device. Now the silicone and implants, for the most part, pretty much all of the implant companies is like a gummy bear in consistency. It's not that liquidy loose silicone that it used to be. So even if your implant ruptures, the silicone sits there, doesn't go anywhere. Like it used to. It used to be like the consistency of molasses, but now it's like the consistency of a gummy bear. So you don't have to worry about, like, women will come in, like I got my breast implants in 1983 and they've been in there that whole time, and all of a sudden it ruptured. Now though, when those ladies come in, it's a mess to clean that out of their chest, like, because that used to be when it was like syrup or molasses. But now, if a person had an implant in the last 5 or 10 years, like, it's usually not liquidy. It's usually a thicker consistency, like that gummy bear type of consistency, especially the last 5 years. And so it's a nice, easy removal, and it's not silicone like spillage or in your chest. Like that doesn't really happen with the new type of implants. But saline implants have a silicone shell. So with an intact implant, it's kind of the same thing. Now, for some reason though, saline implants make a thinner capsule. And the thinner the capsule, the harder it is, and the riskier it is as far as your health and safety to remove it in total. So that's something that you need to consider. Now, when I do breast implants, because some of the women who have the breast implant illness, once the capsule is removed and it's sent off, sometimes it grows things. So that is an indicator that some of these women are sick, because there's like a smoldering kind of like infection, essentially. Even though it's not like a flagrant infection that's obvious, and you got fevers and you're like laid out sick with chills and stuff like you normally do if you have a bad infection. It's almost like it's a few bacteria to cause some inflammation, but not enough to make you be septic and sick and like looking like an infected person. And that's kind of, you know, what I think some of the women may be experiencing who are having these symptoms. And so one of the things that plastic surgeons do, and I guess maybe some do it better than others, is a lot of steps to try to ensure that implant is the risk of contamination of that implant in the process of taking it out of the package, the sterile package, and getting it into the person's body. I am like cuckoo with protocol to try to prevent contamination of that implant. Minimize the number of people who are in the room, because guess where dust comes from? Skin. That stuff just kind of floats off and just is in the air, in the atmosphere. So like, you know, we're obviously masked and gowned, and hair is in a surgical cap, and when the implants are opened, no one touches it. Triple antibiotic irrigation. I bathe my implants in it, like we pour that into the container that the implants are in without touching it. And then I re-prep the area around the incision with betadine before I go to put the implant in there. And then I change my gloves right before I go to introduce the implant in there. And then we use this funnel it almost looks like what bakers use to squeeze the icing onto the cake, to pipe the icing on the cake or to write letters on the cake. It looks like that. And the implant, I literally pour the implant from the container into that thing to keep from touching it, and then introduce the implant via that funnel into the person's body. So, and then I'll squirt some antibiotic irrigation behind that. Okay, and then after that I do a rain dance and I pray to God and I do all this other stuff. I don't really do a rain dance, but I usually pray before surgery. But now, once I get the implant in there, I do have to stick my hand there and make sure it's right side up and make sure the breast parenchyma or breast tissue is evenly distributed over it. I do that, but you know, like I said, my gloves were just changed and fresh. And that's the very limited contact that's made with the implant when I do them. And I don't get infections with my breast implants. I've been blessed in that regard. I don't have that issue. But, you know, things can happen. I'm human and every other surgeon is human. And, you know, sometimes, you know, things can happen. But we definitely try to do everything we can to minimize the potential risk for contamination of the implant. And I definitely think some of the women who are experiencing those symptoms, they may have bacteria or something like that managed to get on the implant. You can get bacteria on your implant though outside of surgery, like dental work, you know, things that break the skin, or if you get a urinary tract infection and it gets into your bloodstream, that stuff is bathing your implant. So it could be introduced after surgery. You know, it doesn't have to be because somebody did something. It could just be what happened because you got a bunch of dental work done and some of that bacteria from your mouth got into your bloodstream, and now since it's in your bloodstream, it gets to go and bathe your implant. Or you know, like I said, a urinary tract infection or any type of infection you have in your body that gets into your blood can potentially cause your implant, the capsule around your implant to become colonized with the bacteria. And that can do it. Because I know that definitely happens sometimes with people with what's called capsular contracture, when the capsule gets inflamed, and then it can harden, it can cause pain. That can happen when you get bacteremia or get bacteria into your bloodstream, because blood goes to every single morsel of your body, and your the capsule around your implant is no exception to that. So, you know, there's sometimes things can just happen with anything. So that's pretty much what I had to say about breast implant illness. To answer the question that I posed on the video, if you're having symptoms, then it's real. And so you need to connect with a board certified plastic surgeon and find somebody who can help you safely remove it, and be reasonable in your request when you're asking for that, because some of the things that some of the women are asking for that they're learning inside of groups that maybe aren't necessarily the best place to be getting all of your information is things that could hurt them worse than the implants ever would. So just, you know, find a doctor that you can trust and then respect their professional opinion. You know, like I'll tell people, you know, my goal is to take out the entire capsule. But if I get in there and it doesn't look safe to do that, I'm not going to kill you to try to get a capsule out. You know, I'm going to take out what I can and I'll burn the rest, and we'll send off what we have. A lot of times I can get the whole thing. There's been a few times where I didn't think it was the right thing to, you know, to put somebody at risk trying to do that. And so, you know, you got to just find somebody that you trust to do the safe thing for you while they're in there, when they can actually see what's going on. So you're going to be fine, Katrinka. You don't need anything. If you're taking antibiotics for no reason, it comes with its own set of risks. If your implants aren't bothering you, then you don't bother them. Enjoy them. It is rare. It is very, 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 very rare. And so, you know, don't talk yourself into something that you don't have going on. Enjoy your implants. Like I told you, when I lose weight, I'm getting some. So, thank you, Tommy. Have a good night, love. At what age is it safe to have the procedure? You mean breast augmentation? I'll do a breast augmentation on anybody who's over the age of 18. As far as silicone, you need to be 22 technically to get silicone implants. That's what they say, even though I have no idea why the FDA picked that number. There's no scientific reason at all to me for saying somebody needs to be 22 to get silicone. Extrovert, versatile, Lucian. I'm located in Johns Creek, Georgia. I do not take insurance. Everybody who comes to me is self-pay. I used to use Sientra, but now I use the Allergan Inspira implants. The gummy bears are not all textured. That's not true. The smooth ones are gummy bears too. That's not true. I just got the implants. It was reconstruction from having an over 600 fiber adenoma. I struggled with the decision. I had the removal of it and waited 3 years, just enough to tissue to lift after a failed lift. Oh, okay. Yeah, enjoy your implants, Katrinka. If you're not, don't look for problems. You know, there's definitely some people who are like, ooh, you know, when they see stuff, they're like, now they're feeling it. It's like, you know, don't do that. If you're not having problems, they're fine. Like, most women are just fine. I do so many breast augs and folks are fine. It's a few. And if you're one of those few, we will take care of you and make sure you're good. But that's not the norm. It's not what everybody's experiencing. The gummy implant, Lynetta, is basically like every implant right now. Like, it's just basically the cohesiveness of the silicone. So back in the day, 20 years ago, silicone implants were more like the texture, like the consistency of like molasses. It was like, you know, if the implant shell breaks, then the silicone could kind of like ooze out and be like in your tissues, just kind of like just oozing. But now breast implants are, I might have one. Okay, y'all gonna be looking at my stairs for a second. I think I have one. I can show you what the gummy bear implants are like now. Hold on one second. I have an implant that's split, and I think it's in my drawer in my bathroom. Hold on. Okay, I'm being real brave. Okay, it's in this bag. I put this in there like 2 years ago to try to keep my kids from playing with it, but I didn't want to throw it away because I can use it for demo. So I don't know what is about to come out of this bag. I hope it don't look too crazy because I have not opened this bag. I've moved twice since I put it in this bag. Oh, oh, it don't look too bad. Okay. It's dusty, but okay, so this is a implant, right? It doesn't look ruptured, right? Where's the hole? It is ruptured. The shell is violated right there. Watch this. See that? It's not liquid. See? So the point is, back in the day, this hole, it would have been coming out, oozing out of this hole like syrup. But now, it just sits, if your shell gets violated, like it's got dust all over it. If the shell gets broken, you see the tear in the shell? You see that tear right there? If it gets broken now, it doesn't go anywhere. It sits right there. Now, you ain't gonna be doing that inside the body, but you see, it's just, it stays put. I can do it upside down. It stays put. So this is how when, you know, people, a lot of times people will show up when their implant is ruptured. It's not deflated. So silicone implants are never filled to capacity. Saline ones are. This is a normal look. This is how silicone implants look. They're never overfilled. But dang, what was I about to say? I need to stop reading the comments. When I'm reading the comments, when I have a thought, then I lose my thought. Dang it, I forgot what I was going to say. Sorry. I'm scrolling down to the other comments. Yes, somebody said, is it possible to get small implants after a reduction or lift for good shape? Yes, it sure is. I do it all the time. It gives you, it makes them look perky again. It gives you that upper pole, like fullness to make them look perky. And so with people like that, I don't use like an implant that gives you a lot of projection. I use an implant that's like more moderate profile instead of higher profile. And so that way, all it's gonna do is, silicone implants are never overfilled. You can't overfill them. All it's gonna do is give you that fullness at the top you want to make them look perky. But it's not gonna really make your bra size bigger. Yeah, saline is overfilled. Saline can be overfilled, but silicone can't. Silicone comes pre-filled. So we put this whole thing in there. Whereas saline, it comes like just the shell and it's empty. And we like roll it up like a taco, slide it in there. It's a little tube attached to it. And we fill it until we, you know, like how it looks or whatever. And then you pull the tube out, cover the little hole up so it doesn't leak, and go on about your business. But you can't do that with a silicone implant because it comes pre-filled and they're never overfilled. But you see, this is the gummy bear, and you see it's also smooth. It's not textured. There's no texture to this implant. I was told you to be unhappy. I'm big again. Now I didn't see your breast, so I can't really speak on that. But I can tell you that I have definitely reduced people and then came back and put a low or moderate profile implant in there, and their bra size didn't change, but they were nice and perky looking. Overfilling definitely causes ripples. So this implant, like when it's overfilled, let me try to do it on the other side. Like when it's overfilled, implants kind of are like, they're like, and if you're really thin, then all of these little things that you see in the shell will translate through your skin. If you have some kind of breast tissue, and you're not really skinny, then it's harder to see the ripples, and it's less likely for you to see ripples with a silicone implant, and especially the cohesive ones, than it is with a saline implant. Technology has nothing to do with scars. You can't get a breast implant into your body without making a scar somewhere. The goal is to put it in a place that is inconspicuous. And put it in a place that's appropriate for whatever type of implant you're getting. So you're gonna have a scar. You just want it to be small and hidden. Is it true when you lose weight, it looks funny? What looks funny when you lose weight? Okay. Well, it looks like the questions are running out. So, and it's late. So I'm going to go ahead and sign off. For those of you who joined in the middle, please share the video. This is a topic that people have definitely been asking about, so you know they can get the opinion of a plastic surgeon about this topic. If you feel like you're sick and it's because of your implants, see a plastic surgeon and let them help you get those things out if it's making you sick. If your implants are not making you sick, don't start reading stuff until they do. Like, you know, just 9 times out of 10 you're fine, because it's so rare. So just remember that, you know, the most important thing is if you're feeling things, you listen to your body, and if you're feeling things that aren't right, go and talk to your plastic surgeon and get evaluated to see if it is something that maybe you need to take them out or whatever. But for the most part, they're safe, and for the most part, they're all like this, gummies. See that? Mm-hmm. All right, everybody, I'm going to go ahead and sign off. I am Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. You can reach me on my website at www.adarabella.com, or you can call my office at 678-325-0006. All right, everybody, I will check y'all later. Share the video. Bye.